Welcome to the Explainer. Every single day, you're dispensing medications for chronic diseases. The statins, the metformin, the blood pressure meds, it's what you do. But what if we're only treating the final chapter of a much longer story? This Explainer is all about equipping you to go upstream, to start seeing lifestyle management not as some extra task, but as maybe the most powerful prescription you can offer.
Okay, so here's our game plan. We're going to start with the why this is your mandate, now more than ever. Then we'll get into the what, talking about the powerful prescriptions of movement and nutrition. And finally, we'll wrap it all up with the how, giving you some really practical tools for assessment and coaching, so you can see firsthand the lasting impact you're going to have.
All right, Section 1, Beyond the Pill Counter. This is all about widening our perspective, connecting the dots between the prescriptions you fill every day and the incredible preventative care you're in a perfect position to provide.
Take a look at these numbers. Cancer, heart disease, stroke. I bet these look pretty familiar, right? And why is that? Well, because they're the very conditions you dispense countless prescriptions for. Back in 2018, these were the leading causes of death in Canada. We are, quite literally, on the front lines, managing the outcomes of these diseases day in and day out.
But this kind of begs the question. We're fantastic at treating the disease, but are we really getting to the cause? What if we could just peel back one more layer and ask, what are the actual causes of these diseases in the first place?
And that leads us right into our next section, Section 2, the actual causes of death. Here, we're going to uncover the modifiable risk factors that are hiding in plain sight behind so many of the conditions you treat every day.
And here they are, the real culprits: smoking, poor diet, not moving enough, too much alcohol, obesity. Just think about it. So much of the chronic disease burden that we treat with medication is rooted right here. This isn't some genetic destiny. These are modifiable behaviors. And that, right there, is our opening. That's where we can make a huge difference.
So if those are the causes, what are the solutions? Well, let's start with a really powerful one. Section 3, the movement prescription. It's time we start thinking about physical activity not just as good advice, but as a potent therapy you can actually prescribe.
And the need for this prescription? It is staggering. 80%. That's how many Canadian adults don't meet even the basic physical activity guidelines. Just let that sink in for a second. 4 out of every 5 patients who walk up to your counter are probably not active enough to get even the most basic health benefits. So why is this so important? Well, because physical activity isn't just good for you. It's a clinical intervention. In fact, it's been called the miracle drug, and for good reason. For conditions like coronary heart disease, its impact on mortality can be just as good as, and sometimes even better than, many of the pills we dispense.
So what's the dose for this so-called miracle drug? The core recommendation for adults is actually pretty simple and easy to remember. 150 minutes a week of moderate to vigorous aerobic activity. That's the target. It's a clear, evidence-based number you can share with total confidence.
But what does moderate even mean to a patient, right? You can make it super clear with this simple test. It's any activity, like a brisk walk, where you can still talk, but you can't sing. It's simple, it's clear, and it's something people can actually use.
Okay, let's move on to the second pillar on our prescription pad. Section 4, the nutrition prescription. Because just like movement, the advice you give on food can have a truly profound therapeutic effect.
And the great news here is you do not need to be a registered dietitian to give life-changing advice. Canada's food guide really boils down to 4 simple rules you can share in like 30 seconds. 1. Eat plenty of whole foods. 2. Choose healthy fats. 3. Limit the highly processed stuff. And 4. Make water your go-to drink. That's pretty much it. That's the core of a healthy diet.
But look, if you only have time to hammer home one single point, make it this one. The research is just undeniable. Ultra-processed foods are a massive driver of chronic disease. On average, they sneak in an extra 500 empty calories to a person's day and are directly linked to obesity, type 2 diabetes, and heart disease, the exact conditions that are filling up your prescription queue.
So we've covered the why and the what. Now we're getting to the most important part, the how. Section 5, patient assessment and coaching.
Let's dig into some simple, effective tools you can start using in your workflow, like tomorrow.
Meet your new favorite tool, the Physical Activity Vital Sign, or PAVS. Seriously, this is a game changer. It's just 2 simple questions you can ask while you're counting pills or doing a med review. In just a few seconds, you get a clear picture of where they're at, and you've opened the door for a brief but incredibly powerful conversation.
Of course, the next question is always about safety. So before you recommend more activity, you can quickly run through these PARQ plus screening questions. Now, a yes to any of these doesn't mean stop. It's just a signal that the patient should probably chat with their doctor first. It's your quick, responsible safety check.
And finally, let's be modern advisors here. Your patients are already on their phones, so why not meet them where they are? Recommending some solid, evidence-based apps like MyFitnessPal or Lose It is kind of like giving your patient a digital health coach. It reinforces your advice 24/7 and extends your positive influence long after they've left the pharmacy.
So, you've got the knowledge, you've got the tools. Let's bring it all home and talk about Section 6, your lasting impact. Because you should never, ever underestimate the power you hold in a single conversation.
Here's the most important takeaway of all. Pharmacology by itself is not enough. Health coaching and these brief interventions, they're a required part of the equation. As one of the most trusted healthcare professionals out there, your recommendation is one of the single most influential factors in whether a patient decides to make a change. Don't ever forget the weight of your words.
So I'll leave you with this challenge. Just think about the patients you're going to see today. Think about that quick, 2-minute conversation you could have using one of these tools. And then just ask yourself, how can one conversation today, planted at just the right moment, completely change the entire trajectory of a patient's tomorrow? That's your power. That's the mandate of the modern pharmacist.